Good morning, everyone, and welcome to the WellMed Charitable Foundation Caregiver Teleconnection session entitled How the Pandemic Impacted Caregivers' Mental Health with Dr. Elliot Montgomery Sklar and Lucy Barylak. I want to tell you a little bit about these two professionals. Lucy Barylak has a master's degree in social work from McGill University. She's presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She's lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy's also a consultant to private industry in the United States, including her work with the WellMed Charitable Foundation and their clinics in Texas. In addition, Lucy would like you to know that she was a caregiver for her mother for about 10 years. Now, Dr. Elliot Montgomery Sklar is a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually probably everywhere. And his research is focused on the complexity of issues related to aging and caregiving. Dr. Sklar is an associate professor of health sciences at Nova Southeastern University in Florida. Last month, he presented 2 talks on our teleconnection program at the American Society on Aging meeting. He also recently published research in the American Journal of Occupational Therapy, the Journal of Applied Gerontology, and the Journal of Social Services Research. And he just informed me that he teaches 12 months out of the year. So welcome. Thank you so much for being with us today, our wonderful experts. Please take it away.
Thank you so much. Welcome, everyone. A while back, Lucy and I had actually envisioned creating a series for caregivers that was based upon certain health conditions that are honored during certain months out of the year. For example, many of us know that November is Alzheimer's Awareness Month. We thought that perhaps a really good place to start was this month with a focus on mental health. Mental Health Awareness Month has been observed in May in the United States since 1949, and it was started by Mental Health America. As such, we're dedicating 2 sessions this month to the issue of mental health. And today's session addresses the mental health of caregivers following the pandemic, which we're still dealing with. And we have a session on May 17th, 2 weeks from today, that will discuss caring for someone with mental illness, which is something we've not talked about before and something that we really need to be talking more about. Each year, millions of Americans face the reality of living with a mental illness. We've talked a lot about mental health as we have been addressing the pandemic. Many caregivers were already feeling stress and burnout ahead of the pandemic, but it's been compounded by the stress of enduring a global pandemic, which has been very challenging. Even for those of us who feel like we got through just fine, we're still getting through. And there is still continued stress, unrest, grief, anger, I think, and some sadness around us too for the better part of the past 2 years. So I've likened the experience of going through this pandemic to having been on a treadmill for 2 years. And what happens when we get off of a treadmill, even for 30 minutes, is that we feel out of breath, we feel tired, we feel exhausted. Some of us feel energized if it's only 30 minutes. But I think this past 2 years has been really exhausting for many of us. Lucy, you're on mute.
Thank you. I unmuted myself. That's technology. Good morning, everybody, and welcome. Yeah, today we are talking about mental health. It is Mental Health Awareness Month. You know, being a caregiver is difficult in the best of circumstances, but I always say that it's also extremely rewarding. So while I'm talking, take a look at the slide and just look at the advice for family caregivers, how to take care of yourself. The stress and challenges of of the role can have a huge impact on family caregivers' mental health, leading to more family caregivers experiencing depression. We know that. post-traumatic stress disorder, alcohol and addiction abuse, and anxiety. It goes without saying that it's important for family caregivers to take care of themselves, both physically and mentally. And on a personal level, I know that for a fact that I had to do that for the 10 years that I cared for my mother. Not only for our own well-being, but also to be able to continue to be a source of support for their loved ones. But the question is how? We hope that our session today will help to answer the question. The how is different for different people, so that's a given. But one key factor is that its consistency is to find support and not to isolate yourself from others.
I would certainly agree with that. Um, I think also one of the unique things that we're doing a little bit differently that we wanted to share with everyone today is that rather than providing a resource slide, as we usually do at the end of our presentation, we're providing you all with interactive resources. So you don't have to worry about taking notes. We'll send a copy of this slide deck to everyone, and they include hyperlinks. If you don't know what a hyperlink is, it is this underlined blue font, and you'll see that throughout our presentation. So we're also going to be including some self-assessments, which is different than what we usually do. We want to leave you all with a toolkit of resources to take with you from our time today. And all of it will be contained in our slides. And like I said, you have the option of doing a little bit of homework if you want to take some of these self-assessments. They're really quite great. Now, one of the challenges with all of the new research coming out about how the pandemic has affected mental health is that our experience with COVID, as we know, has been a moving target. Research that may have been done, for example, in 2020, is only being published now. And research that was done a year ago, for example, might only be published later this year. So the research that's coming out may not accurately reflect some of these same issues that we're dealing with right now. One of the most recently published articles, titled Caregivers of People with Dementia and Mental Health During COVID-19, how apropos for our session today, was published in late January of this year. And the findings are as follows. We found that caregivers' burden, anxiety symptoms, depression, and perceived loneliness were marked during the first wave of the COVID pandemic. Now that's back in March 2020. As the pandemic endures, support to caregivers of people with dementia should be proportionate and tailored to needs and adapted to contextual factors. Well, that's important research, and it's a mouthful of a finding, but maybe it's a little bit late for this finding to be relevant and timely in supporting caregivers of people with dementia. There are new issues and new concerns that we're dealing with in real time. One of the strengths that Lucy and I have in leading our program today is all of you who are participating. We've facilitated somewhere between 75 and 100 programs, I lost count, strictly dedicated to the pandemic and how it's affected caregivers since the very first week we went into lockdown, actually. In these programs, we've had about 2,500 unique participants, which is quite amazing, many of whom have shared their struggles, but also their tips and their lessons learned. So, as I mentioned, we launched our first COVID-focused teleconnection program the first week we went into lockdown. And as Evelyn mentioned, I gave a talk about our teleconnection and the work we did on COVID last month at the American Society on Aging meeting. One of the strengths of the teleconnection program has been the ability to adapt programming and to reach caregivers wherever they are and where they are. So our program today addresses what the research says, but really also includes the experiences of our caregivers. And we recognize that not all research mirrors the actual lived experiences of some of you participating today. So we would love it if you would share your perspectives and also your experiences. So I'm curious for those participating today, how are you feeling right now at this point in the pandemic? Do you feel refreshed? Are you feeling burnt out? Do you feel better or worse than you did a year ago?
Okay, folks, this is your opportunity. Just press *6 if you're on the phone. If you've zoomed in, just unmute yourself. We would love to hear from you.
I feel more worn out and tired and less ambitious, less motivated.
I feel you on all points.
Normal reaction for sure. And that's why it's so important. I'm so glad that you're acknowledging how you're feeling, because only then can you kind of decide what can you do to sort of enhance or feel better about things. Just to share a little something, sorry, still a little lingering cold. I had a wedding shower for my daughter yesterday, and my anxiety level of people coming together, and they all knew you can come, you can wear your mask, it's whatever you wanted to do. So even though it was such a wonderful event and everything went well, the anxiety was still there. Not only that, but this morning when my oldest daughter called and said, I have a cold, I said, oh my God. My first reaction was get tested. If you have COVID, God forbid, I have to call all these people. So we're in a new kind of way of looking at life. I think it's going to be part of what's going on. So then she took her test. She's negative. Big sigh of relief. So I guess it's there, so it's normal for us to feel different.
And as I said before, it's a moving target, where everything's changing constantly. Can we let our guard down? Can we take our masks down? Do we put them back up? What's our case community transmission rate? It's still very, very much taxing, especially if you're someone who's concerned about your own health or the health of a loved one.
I feel a little numb. There's so much. You read all these things, there's so much stuff in the paper, there's local stuff that comes out, there's, junk on the news, and you go like, what? And it's like, what do I believe? How much of this can I incorporate into my daily activity?
Understood, certainly. So Lucy, I wanted to ask you something, because I had talked a bit earlier about that experience of being on a treadmill for 2 years and how exhausted I think many of us are feeling. Now, among mental health challenges that caregivers are experiencing right now, I would suspect burnout to be one of the top key issues. So what can people do if they're feeling burnt out?
Good question. And we look at the slide, and I have to tell you that we talk about exercise. If it wasn't for exercise and deep breathing for me, it would have been a very, very difficult and would be difficult time. I'm going back to, when I was taking care of my mother, taking care of a loved one who has dementia or physical disabilities or other related condition makes a lot of demands on our time, our energy, our emotions, and the pandemic added to that as we're talking about it and changed things for many caregivers, that's for sure. And again, caregiving taxes your patience, and you're tired, as we just heard, frustrated, and sometimes we feel guilty. It's difficult. It's a heavy burden to control. It takes a toll on our bodies, on our mental and physical well-being. The effects of physical and mental health are well documented. So, 36%, believe it or not, of family caregivers characterize their situation as highly stressful, according to the Caregiving in the US 2020 report from the AARP and the National Alliance for Caregivers. I wonder what the statistic is now. That was in 2020. Stress is linked with burnout. So it's important to manage stress and recognize signs of burnout. Burnout has had a very big, high impact, believe it or not, on healthcare workers too during the pandemic and even now. So it's really true for all caregivers, whether you're a paid caregiver or not. You know, the first thing you need to do, as I said before, is acknowledge your feelings. And I was just wondering, let me tell you, has anybody heard of Dr. Leora Brim? There she is. There's her picture. Let me tell you.
Lorna Breen.
Lorna Brim. Did I say her name wrong? I did. Okay. I apologize. You know, Lorna was an emergency medicine physician at the New York's Columbia University Medical Center. She worked the front lines at the early peak of the pandemic. And she contracted COVID-19 herself. While recovering from COVID-19 and struggling both mentally and physically, she chose to work 12-hour shifts to help others. Her family says she would stay well past the end of her shift and became so overworked. She feared losing her medical license and receiving criticism from colleagues. If she let it be known that she was suffering from the workload. She died by suicide in 2020. Her anxiety and her mental health was that bad. In her honor, President Joe Biden signed the Dr. Leora Brim Healthcare Provider Protection Act. The new law, which is the first to provide such funding, is towards supporting mental health education and awareness campaign for healthcare workers. The law will provide up to $135 million over 3 years to improve medical workers' mental health. There is limited formal research about burnout experienced by healthcare workers during the pandemic. About 2/3 of the US physicians said that burnout had intensified during the pandemic. Women physicians reported a higher burnout rate of 70% compared to 61% of men. We can draw upon this as it relates to nursing care facilities and the staffing shortages they have experienced, in addition to high death tolls experienced early in the pandemic. You know, healthcare professionals often forego mental health treatment due to significant stigma in both our society and the medical community, as well as due to the fear of professional being criticized. So even though we are in 2022, mental health is still seen as a stigma attached to it for a lot of us. You know, the Alzheimer's Associations cites these 12 indicators that a caregiver may be experiencing a high level of stress. So let's just talk a little bit about it. There's anger, there's frustration, anxiety, denial, depression, exhaustion. We talked about that. Health problems, inability to concentrate, irritability, moodiness, sleeplessness, social withdrawal. So I really, want to kind of ask the audience, does anyone in our audience feel the stress of caregiving? If yes, we're here to support you. And share with us.
Okay, folks, all you need to do is to unmute your phone by pressing, *6, or you can unmute your Zoom. We really would love to hear from you. It makes our podcast richer. It informs us so that we can do a better job all the time. So please chime in. You know what I don't see on this list, Lucy, is worry.
Oh, there's a lot more that can go on the list, for sure.
I think worry is at the root of so many of these different things. People are worried about their health, their loved one's health.
Well, all of this kind of goes back to anxiety. Anxiety has a lot of all those feelings there. I think I heard somebody speaking.
Lorraine wants to talk.
Fear is something that I'm seeing. I'm not necessarily a caretaker, but I'm a practitioner. And one of the things I'm seeing in a lot of my clients is fear, and around my family as well. There's a lot of fear of, can we get together? There's some people that haven't gotten their shots, and there's some people that have. And so we stopped doing family stuff And I was expecting a drive-by for my birthday,
Oh,
but I didn't get it. That actually bummed me out. That was
oh.
last year. I was like, oh, drive-by at least, you know.
Yeah, there's sadness attached to that for sure.
Mhm, mhm.
To know what is the right thing to do, even when I was talking about the shower, who do I invite? Do I put people in an awkward position if they have medical issues like diabetes or anything? It's complicated, but I think the most important thing really to do is to be able to evaluate yourself, as Elliot was talking about, and to really identify what am I going through, and to find the solutions of how to get back on track. So let's look at another tool to evaluate whether caregiving for a loved one is taking a toll. It's called the Caregiver Self-Assessment Questionnaire that the American Medical Association developed and the American Psychological Association recommends. So here are tips to reduce caregiver stress. So let's kind of look at that. I think that it's so important to give yourself a break. Ask a friend or a relative to fill in for you for a few hours occasionally so you can take a walk, watch a movie, or go out for dinner. Give yourself credit for the things that you do, all right? If you don't have the support of informal support available or feel you need more structure, like a respite care, look into other options through the National Respite Locator. This online service provided by the nonprofit Access to Respite Care and the Help National Respite Network can help you find adult day center and home care services in your area. So you really need to outreach and not feel that you're isolated. There are a lot of services out there. Simplify your communication. What do I mean by that? Keeping extended family and friends up to date about your loved one's situation through phone calls or individual emails can be tiring, and you may not want to broadcast that information on social media. So it's a good balance. I think it's important, though, to tell the people that you trust and to share. You don't have to tell everybody. I mean, it is communication. It's exhausting. you know, Tap into online resources. The US government's elder care locator can connect you with local area agencies on aging, which can guide you to resources in your community to help you deal with the challenges you're facing. So these are services are in every area, and you really should reach out. I'm going to give you a number, but you're going to have all that information available to you. And so it's the locator, the elder care locator is 800-677-1116. With Community Resource Finder, online database from the AARP and the Alzheimer's Association, you can find a range of programs, services in your area, from the elder care locator, to transportation. And another very good resource is the Family Caregiver Alliance, Family Caregiver Navigator can help you locate local resources. So if you're taking care of a loved one with Alzheimer's disease, the Alzheimer's Association offers a locator for support groups in your area. The AARP has online caregiving forum and Facebook discussion group where caregivers can share information and advice, and the Family Caregiver Alliance operator online supports groups that communicates via email. So I guess what I'm trying to say is please, please don't isolate yourself. So, I think it's also very important, nurture positive relationships. You may be overwhelmed, but take the time to talk with your closest friends and family members that you trust. Spend an evening with someone who is a good listener. Limit your interactions with negative people who will drag you down and your mood and your perspective. Negative people like company. You don't need that in your life right now. And I know it's not easy because you might have some good friends, but I have to tell you on a personal level, um, I try not to connect that often with negative people, even though some of them are wonderful. But you need to save your mental well-being. Take care of your own health. Set a goal to establish a good sleep routine and to exercise a certain number of hours every week. I know we keep drilling it in, but we wouldn't do it if it wasn't working on us. And Elliot can attest to that. I mean, I do my daily walk. I don't have to necessarily go to the gym. He's much better than I am, but I do my walk. I do my stairs in the building. Right, Elliot? You're exercising. It lifts me up
Absolutely.
completely. Yeah.
Absolutely. And I've noticed over the course of the pandemic when I've had an injury or not been able to keep up with my my exercise routine, it absolutely affects my mood, my outlook, my resilience. I sort of feel like if I can get through my workout, I can get through anything else in the day.
One of the things I also want to share with you, which I started only during the pandemic, is my breathing exercises. It's amazing. I take those 10 big breaths and it's as if something has just come off my shoulders. So try it. So I really want to ask, does anyone have tips, other tips that you would like to share that reduces your stress, or any other exercises that you do? We always laugh about it. I dance around my living room every single day listening to music. I have to tell you, because the music makes me happy. So it changes my mood if I'm down. Anybody want to share your exercise routine or how you deal with your stress? We'd love to hear from you.
I'd like to have one of these presentations where you just show us how you dance around your living room.
I know you've been trying to get me to do that. I promise you, Evelyn, at one point, I will record myself. Then everyone can have a really good laugh.
Well, and let me say something about your walks too, Lucy, because there's so much research that is attaching mental health and lower levels of dementia to simply walking every day.
For
Well,
sure.
it's very much akin to the research that has actually found a correlation between men who take Viagra and a lower incidence of Alzheimer's and dementia, both of which increase your blood flow. And so those are very important things to maintaining overall function, especially as we age and we know that circulation gets poor and so on. So exercise is an antidote.
Anybody else? Just unmute your phone or your Zoom.
My problem is I know these things, and every day I tell myself, okay, today I'm going to start walking. And I just don't. I can't seem to get out of my chair and get motivated enough to do exercise for me. I have a lot of pain in my feet and in my back, and I know that this is good for me. And swimming would be great, but it's just getting the motivation to get up and get out there and, choose life over slowly dying. So.
Well, I don't want you to be so hard on yourself. Can I make a suggestion?
Oh, sure.
Start slowly. If you're sitting in a chair or you're watching TV, start doing exercise in your chair. Lift your legs one at a time. Once your leg is lifted up, just twirl your ankles one way 10 times. Twirl your ankles the other time. Start easy. Then with the next leg. You can do the same thing with your arms. Lift your arms up. Look, I'm sitting. I can so much stress, even behind my chair. Oh my God, that feels so good. And then you can go forward. So again, don't be so hard on yourself. Try that. Try 5 minutes every day and see if that's going to climb. And then motivate yourself. Get up from your chair. Start dancing around like Lucy does. Eventually, you'll start going outside. I have faith in you.
One of our participants, Ella, has suggested going to YouTube. There are exercises for seniors. It's a great suggestion. And Lucy and I have also done a session on the positive aspects of caregiving, and we share some in-chair exercises for participants as well. But one of them that's great, if you have a bottle of water, which you should always have around with you. I know it's not great to drink out of plastic, But the point being is that we still want to get our water. You can do bicep curls with your water bottle. You can do tricep curls with your water bottle. There's so many different things that you can do and that you can also do with the person for whom you might be providing care. And that's a wonderful, unique thing of the exercises that we've talked about in our program, is that we want to encourage physical activity, not only for ourselves, but in the people for whom we're providing care. So chair exercises are wonderful. And Laureen, I feel from you everything that you're saying today. And we're very good at being hard on ourselves. We're much less good at being kind to ourselves. So give yourself a pat on the back just for making it through these past 2 years and being resilient. You know, the exercise is great, but the journey of 1,000 steps begins with just one. And I'll share with you personally how I got into exercise. It was not, I was the kid in gym class who was picked last. I never felt good about exercise. I never felt comfortable at a gym. But at this point in my life, exercise is important for my health. But that alone wouldn't be enough to motivate me to go to the gym. It was enough to get me in there. But I found if I committed to myself to go a couple of times a week, 3 or 4 times a week for 20 or 30 minutes, after 2 to 3 weeks, I started to notice how much better I was feeling mentally. And that has been what has kept me going to the gym. It takes about 2 to 3 weeks of consistent exercise, about 3 to 4 times a week, for it to actually start changing your brain chemistry. And it is really effective.
We just got a little note. I think it was Ella who had a very good point. I think she was saying before starting any exercises to make sure that you do speak to your doctor first. Which is
Always,
Well-
absolutely. And to see also what your insurance can cover. A lot of people have silver sneakers programs in their communities. My gym is a silver sneakers member. And it's wonderful to see people of all ages exercising together. I also joined a Pilates studio, and I think I'm one of the youngest people by about 2 decades. I'm mostly there with ladies in their 50s, 60s, 70s, and I love it. And they can do things that I can't because it's a practice and they've been at it for so long.
Wow.
Thank you.
we have faith in you, Elliot. You'll get there.
So
a
you,
practice.
Laureen.
Thank you.
So
Yeah.
I wanted to remind everyone today also that with these slides, again, anytime you see this blue font here underlined, and we'll be sharing it after our session, you can just click on those links that will be in the PDF if you want to access these resources. And Laureen, you brought up one more really important thing about your birthday. You know, when I think back at the beginning of the pandemic, it was characterized for me by 2 things. Fear. I was very afraid of getting COVID. I lived in a very large apartment building. I have asthma, a lot of predisposing concerns. And obviously vaccines weren't available at that time. I lived on the 16th floor. I would avoid the elevators and walk up and down 16 flights of stairs.
That's good.
There was a lot of fear, but also a lot of connection. We had Zoom happy hours and Zoom birthdays, and I felt like I was speaking with people more and having FaceTime with people more than I necessarily did in my real life pre-pandemic. But people got sick of that very, very quickly. And at this point, no one has these Zoom happy hours. No one's celebrating things virtually. We're all just expected to go back to business as usual, but it's not business as usual. So I'm glad that you acknowledge that. And I think there are other ways of celebrating, and I think you need to still celebrate your birthday in a way that works and feels good for you. It's
Happy
very
belated
important.
birthday.
Happy belated indeed.
Well, maybe you can have a belated Zoom birthday for yourself and organize and invite everybody and have a drink.
It's coming up in 11 days again.
Well, join us for our next session, and then we can all be together and celebrate together.
I'm flying to Virginia this time to go see my daughter.
Good for you.
Good for you.
So you bring up a question that I was actually going to pose to our audience. You know, we often talk about how important it is to to take respite or to visit with family, especially if you're a caregiver or a professional healthcare worker. So now that airlines have reversed course on mask mandates, how do you feel about traveling?
I'm going to wear a mask and a shield and a long sleeve shirt that I'm going to throw in the washer when I get home. And I'll change my clothes when I get home because I definitely don't want to bring anything to my daughter's house. We all have underlying health issues in my family. So there has been a lot of fear, a lot of caution. And I still managed to get COVID this last January. So, and we lived through it. It was a mild case. So that was good. I was actually thankful because it took some of the fear away and the fact that I got COVID and lived and I didn't go to the hospital. And yeah, it was after my 3 shots. I've now had the 4th one. And I'm not going to let it stop me from seeing my daughter. So.
No, but you're still taking precautions, which
Yes.
I guess reinforces the fact that I guess my point really is that we're still in a pandemic. As Lucy said, we're still anxious, we're still worried, we're still thinking about things that we wouldn't have 2.5 years ago.
Right.
And so you raise a good point, and I think many people would feel the same. I recently traveled, and a lot of people, even though this was before the mask mandate was changed, a lot of people on the flight weren't wearing masks, and it made me rather uncomfortable, especially as a public health professional. Obviously, if you have a contagious virus, then anytime you're in a closed, contained space with people, it's of concern. So I want to remind people, again, wearing an N95 mask, if you want to wear one, will give you your best protection. The face shield is great too. But it's just, I talk sometimes about taking our temperature, and it's a good moment to sort of take reflection that we're still in it as much as we wish that we were not.
Right. I remember the first time I flew up there, I went in a hazmat suit.
Of course, I understand.
One guy taking a video of me when I got off the airplane, and I thought he was taking a picture of somebody behind me, so I kind of moved out of the way, and he aimed the camera at me. I said, "Oh, you're filming me? Okay." So I'm sure I was on YouTube somewhere.
Not to worry. I felt the same when I was traveling a few weeks ago. I had a little bottle of Lysol with me. I sprayed everything down on my feet and all the surfaces. But I was doing that before the pandemic. So people must have thought I was crazy then too.
Little did they know.
Nevertheless, cases of major depressive disorder and anxiety disorders have increased more than 25% worldwide. And that's according to a world first study on the impact of COVID on mental health. The study is also the first to assess and address global impacts of the pandemic on major depressive and anxiety disorders. Now, quantifying the prevalence and burden of the disorders also by age, sex, and location, which is very interesting. The study found that the pandemic made worse, many existing social inequities that predispose people to developing mental disorders. The research found that cases of depressive disorder and anxiety increased by 28% and 26% respectively, with women affected more than men. And interestingly, younger people affected more than older people. Experiencing or witnessing life-threatening or traumatic events impact everyone differently. In some circumstances, the distress can be managed successfully to reduce negative health and behavioral outcomes. In other cases, people may experience clinically significant stress or impairment, such as acute stress disorder or post-traumatic stress disorder. Compassion fatigue and burnout may also result from chronic workplace stress and exposure to traumatic events during the pandemic. So for example, we know nurses who saw a lot of people pass, had a lot of trauma early in the pandemic and are still working through that. So again, we encourage people to reach out for help if you need it. There is a disaster distress helpline, which can be reached by phone or by text at 1-800-985-5000. 5990. And again, all those resources will be shared after our program today. I'm sensitive to time, so I think, Lucy, if you'd like to move on to the next portion of our presentation.
Yeah, if you can just go to slide 11, please. Thank you. Okay.
I'm going to just pause for one quick second because I don't want to skip this slide. Since we have all these wonderful linked resources here, and you'll be receiving them, don't forget that you can click on them to take the assessment tool and also to receive the family caregiver toolbox here. Sorry about that, Lucy.
No, it's fine. Good. I guess what Elliot and I we keep saying, acknowledge your feelings. What we're saying when we say acknowledge your feelings is to identify what you're going through. And only then can you start really dealing with the situation, whether it's getting some counseling or whatever it is. So one of the things we're going to talk about today is assess yourself, okay? Signs of mental health issues may be present even when you don't recognize them right away. This can be especially true in time when so much is new and uncertain as we're talking about it. So this assessment tool specifically for family caregivers and was developed in collaboration with the Mental Health it was developed with the Mental Health America, will help you identify issues such as depression, anxiety, post-traumatic stress disorder, so you can better find the help that you need. So if you do assess yourself, definitely always get in touch with your doctor, that's for sure. You need to seek support. That is very, very important. We keep encouraging people to not isolate yourself and not do it on your own. So it's important to continue to build your support network. This can occur in several different ways. So it's important staying in touch with friends and family. I'm just reviewing things. We noted earlier how it's important to stay connected with your loved one if you're currently apart. The same applies to the group of friends and family that you rely on for support. This can take the shape of regular phone calls, video chat, or text messages. Stay in touch and let them know how you're feeling. Now, even if you're going through things with your loved one that might be embarrassing or you don't want to share with it, it's important to the people that you do trust, especially your family or children, let them know what's going on. Let them know that you need help. It's also good to find an online support group or forum. Family caregivers turn to support groups for many, many different reasons. Every one of us has to decide. For some people, support groups are good. For other people, they prefer individual counseling. If that's what you're comfortable with, by all means, definitely reach out. There are resources, as I said, in the community. Let's look at keeping caregiving. Despite the current situation, caregiving as usual happens. We still are caregivers. Your loved one may have doctor appointments or there may be prescriptions to fill out. It's important to know that there are resources to support you, even if it isn't specifically related to or impacted by COVID-19. CAN's Family Caregiver Toolbox is well equipped with resources and information to help you. This is a really great resource. Our organization has also launched Caregiver Help Desk, a tool where you can be connected with caregiving experts via phone, and it's 855-227-3640, live chat or emails. Again, so I was saying, if you're not comfortable in a support group, seek professional help. You can still access professional help while at home. If you currently see a therapist or counselor for regular sessions, ask them about holding these sessions virtually. And I think a lot are doing that. Many practices have switched to this mode for the time being and are happy to make these arrangements. We are living in challenging times. Our hopes is that these tools and tips will help you feel more equipped and confident in taking care of yourself so you can continue to be the best source of support possible for your loved one. So I've said a lot in a very short time because I'm also looking at the time factor. So Elliot, what do you think? What are your thoughts?
All good information. And again, we'll be sharing this with everyone. I wanted to find out if anyone had ever heard of the term syndemic. Syndemic is the combination of two or more concurrent epidemics or disease clusters in a population, which may exacerbate prognosis and burden of disease. So in more simple terms, a syndemic involves biological and social interactions. You might have heard Lucy and I say that there are two pandemics going on, one of mental health and one of physical health with COVID. Syndemic is a very good example of that. We have also seen how the pandemic has affected mental health, certainly. I said before that it's like the experience of being on a treadmill for 2 years or getting through a storm, for example. Many people make it through a hurricane just fine, and then the trauma of the experience hits them afterward. We need to be resilient when we feel like we can't let our guard down, and then the stress of the experience can sometimes catch up with us. And that is, I think, how many of us are feeling. One of the effects of how the pandemic has affected mental health has been, as we discussed, through anxiety and depression. We know that pre-pandemic, almost 10% of people were using mental health services in 2019. Over 50% had reported that the pandemic had a negative impact on their mental health. And of those, 12% reported an increase in alcohol or drug use. There's also been an increase in gambling during the early part of the pandemic online. That was quite marked at 43%. And a study in May 2020 showed that 44% of women and 22% of men, at least self-reported, they experienced weight gain at the very beginning of the pandemic and our shutdown. So these are all signs and symptoms of how our mental health has been affected during this experience, and how maladaptive coping can sometimes play into things. I think what's important is that we should recognize, like I said, it's easier to be hard on ourselves than to be kind to ourselves. And we've been through quite a stressful experience here. What else here? I'm trying to go through things quickly. I apologize because of our time. I think, Lucy, this is a good segue into your last portion for our program.
Yeah, I really believe that we have to look at addiction. A lot of caregivers, from the statistics and from research, are drinking a little bit too much, maybe taking over-the-counter medication too much to sleep, for example, which can become addictive. It could also be using pain medication, not only prescribed pain medication, but over-the-counter medication. And so you have to be really, really conscious, because addiction is a disease. In the past, people often spoke about addiction as a lack of willpower, as a selfish act, as an expression of weakness. It's not the case. Addiction is a disease. Over time, can physically change a person's brain, believe it or not, the way they behave and act, and even aspects of their personality. This disease can have both physical and major psychological repercussions. The disease addiction, it can be treated like you would treat diabetes or any other disease. So please be mindful. If you know yourself better than anyone, if you're having a problem with any of these things, please call the doctor and go and get yourself checked out. I also want to point out again, it's not a shame to have some sort of a mental health episode going on in your life. It's normal. We're only human, okay? So even though there's stigma attached to mental health in our society, unfortunately, I think it's very important to be able to get the help that you need. Periodically I do a session on addiction, and I think I'm going to do it very shortly again, just to talk about it. And it could be for addiction for your loved one, not necessarily just for caregivers.
Elliot, can I ask you a question?
Always.
And it may be too long to answer now, but I worry about the burgeoning telehealth in mental health, where they've even been given permission to order opioid drugs on the phone, and hedge funds are buying them up. It's become so rapidly growing. And I worry about how people find a good provider.
It's an excellent question. You can certainly get referrals through your health insurance. That doesn't necessarily mean that you'll find a good provider. You'll find someone in network. A lot of it is guess and see and test out. It's a relationship with the provider, like with a relationship in any other way. Sometimes you have to just test out the waters and find a good clinician that you feel confident and comfortable with. I think pill mills and pill dispensaries are always still going to be there. Where there's a will, there's a way, and people want that. But it's different and distinct from the kind of help that we're talking about seeking out. And so I think it's very important that you always, and Lucy and I say this all the time, speak with your primary care physician, get referrals through them, look within your community. I would caution right now the use of too many of these online services. And many of the ones that you're describing, Evelyn, don't accept insurance either. So there's a barrier right there for many people.
I just want to quickly take a minute to just look at the signs of addiction, okay?
Sorry.
It's lack of control, decreased socialization, withdrawal, distinct changes in your sleeping habits, chronic fatigue, constant illness, injuries, physical changes, bad skin, hair, teeth, nails, memory loss, depression, aggressive behavior, apathy, and more. So it's important if you're feeling any, doesn't mean that you're addicted, but if you're feeling any of these signs and you're taking, maybe taking one too many glasses of wine, be cautious, be vigilant, get the help you need.
So we have a couple of minutes ahead of the hour. I know, Evelyn, you have some housekeeping and sharing of information. I did just want to ask if anyone participating today had any concluding questions or comments, and certainly invite you all to join us 2 weeks from today when we'll be talking about caring for someone with mental health issues, which is such an important thing that many of us are dealing with right now as we're dealing with our own struggles.
Laureen, you've opened up again?
Yes, I'm a mental health provider. And yes, there is still a stigma with mental health and going to counselors and stuff like that. But if you're looking for a good counselor, there's a website for Psychology Today, and they have their bios on the website. And you can go to your insurance company and check and see if they're on your network or not. But the bios will tell you a little bit about that person. And what I do is I read the bios till I find one that one strikes, that one hits home. That one seems to be able to understand what my needs are. And that helps a lot. You're not going in totally blind.
Absolutely. Very important to do your research. And one of the nice things about many of the health insurance websites now is that they are linked to provider bios and information on other credentialing sites too.
Thank you, Laureen.
We've got a chat. We've got, let's see here, Dell.
Hello, friends. Great webinar again. I'm an RN and I wear my mask, surgical and KN95 when and where needed, everywhere. People have begun to look at me and my daughter who wears her mask as well, strangely, but we don't care. I've traveled with my mask as well. This is a way of alleviating my anxiety, right there with you. I should preface this by stating my daughter was diagnosed with cancer in March 2020 and remains on oral chemotherapy. So the wearing of masks for us is to prevent getting infected with COVID, as well as a psychological Band-Aid of sorts. We love this feeling of protection. Thank you for all the information you provide in these webinars. I'm also a volunteer with AmeriCorps, both by phone, now restarting in person, and I love it. I exercise regularly. I encourage my clients to do so as well. I think this connection throughout the pandemic has helped us both. Thank you all again. Thank you so much for that comment. And Laureen had referred us to Psychology Today, which was someone's question in the chat as well.
Great. Let me do a tiny bit of housekeeping here, if you don't mind, because I know people are going to be really interested in what you're doing throughout the month and also what other people are doing. But I want people to know first that in several days, you'll be receiving your post-session questionnaire. Now, this is really important to us, and we hope that you will fill it out, that you will take time to really, be honest and help us know how we can improve, because we would like that very much. And also, if you're not registered, you won't get the resources. So and you won't get the slides. So please, if you just got I got the number from somebody else and you didn't register, go ahead and register by calling WellMed Charitable Foundation's customer service, 866-390-6491, 866-390-6491. And that's if you're not already registered. I want to tell you about a few of the sessions that are coming up, because it's not, certainly I'm going to miss your next one, Elliot and Lucy, but I will certainly watch that podcast. I'm going to be in Seattle and I'm going to be wearing my mask on the plane. Next week, we have on Tuesday, it's out of order, sorry. On Thursday, we have online at ABCs of Alzheimer's with Tam Cummings. She's really an expert in dementia. We also have on Thursday, the federal, state, and local services that are available for people over the age of 60 and their families. On the, let's see, I just didn't print this out right and I'm confused. But I will tell you, if you get registered, you're going to get the monthly calendar and you'll be able to see all of these. And there's some really great ones. Caring for someone with mental health issues, particularly during this month. It's also Older Americans Month. So congratulations to all of us who are older Americans. And Lucy's going to talk about what seniors need to know and their caregivers need to know about delirium. We also have one on frontotemporal degeneration coming up. And we have Dr. Jamie Heisman again with a really short title, Within Us All Are Superpowers That We Underestimate That Can Get Us Through Many Challenges. Good old Jamie. And he's really a good speaker. Everybody loves him. He's very entertaining. And he can teach you how to breathe. He always teaches people how to do vagal breathing at the end of his sessions, which is really important and it's actually experience, or it's based on research. So we know that it works. So with that, I want to thank our speakers so much for yet another beautiful job I love the connection that you're giving people these resources and these toolkits. It's so wonderful that we can actually look at ourselves without having to go get an assessment somewhere else and see, if we agree with it and if we find ourselves needing something. I'd also like to thank all of you for being with us today. Thank you so much. Lorraine, you were great. Thank you for, helping us out with your information. And I want to thank the WellMed Charitable Foundation for supporting caregivers in clinics, community centers, the teleconnection sessions, and that website. Don't forget about that website, folks. So with that, I am going to stop the recording and just thank you all so much for your participation today.
Bye,
Thank you so much, everyone. Bye-bye.
Bye-bye now.